Building an interprofessional practice experience to provide care to the unsheltered and uninsured population at Grace Clinic. I am Dr. Janet Enderle, School of Health Professions faculty at the University of Texas Medical Branch in Galveston, Texas. I am in the Clinical Laboratory Sciences Department and a member of the team at Grace Clinic in Galveston. Options for healthcare are limited and at times non-existent for unsheltered and low-income residents. Contributing factors are health insurance status, documentation and identification status, difficulty traveling to the healthcare provider, and distrust of the healthcare system. One solution for providing care to the community's historically excluded persons centers around established healthcare teams partnering with inner-city church and nonprofit organizations. We have recruited healthcare providers from diverse disciplines to address the needs of unsheltered and uninsured people who routinely meet at Galveston Central Church for services such as meals, showers, laundry, and computer access. An interprofessional group of faculty and students from our university, along with oversight, guidance, and involvement from church leadership, has established Grace Clinic that meets once a week to treat acute and chronic conditions along with social concerns for those in need of assistance. We have operated the clinic full-time since March 2022. Teams from physical therapy, occupational therapy, medicine, clinical laboratory sciences, social work, nursing, and medical humanities have developed a continuity of care model that utilizes students in training under the guidance of university faculty to diagnose, treat, and importantly, socialize with these members of the community. Our patient population for the last few months, March through July of 2023, has been captured and displayed below in the different graphs. We saw a total of 261 persons in that time period, and these included critical services that were provided at no cost to the patient. Otherwise, they would not have been able to access services, and that includes referrals to specialty clinics, medications for diabetes and hypertension, assistive devices for mobility, and screening for communicable diseases. Patients meet with a social worker who helps them with housing needs, Social Security paperwork, and nutritional assistance programs. All visitors to the clinic are offered foot care, where they are assessed for wounds and calluses, their toenails trimmed and creams applied, and new shoes and socks are offered. This interaction between the provider and the recipient initiates an ongoing conversation between those who have access to health care and those who do not, those who are sheltered and those who are not, those who serve and those who are served. Week after week, where all can be heard and seen in this space. As you can see in the graphs below, we have captured the 261 patients by gender and displayed race, their ages, and employment status. The majority of the patients in this particular cohort between March and July of this year are male at 61% compared to females at 39%. Their race is predominantly Caucasian and white, with a total of 160 of those persons, or 61%. The second highest race that we've seen at the clinic is the Black and African American population at 26%. There are around 12% who are unknown, and then one person who was seen who identified as American Indian and Alaskan Native. As for ages, these were grouped into periods of 9 years, except for the first group of 18 to 19 years of age. We saw no one under the age of 18. There were 3 patients in that group. The next level is 20 to 29. There were 6 persons seen. And then 30 to 39, there were 30 people. Then we get up into some of the higher numbers, the majority of the people were seen in the 50 to 59 age group at 37%. Then we had the 60 to 69 year age group at 27%. And finally, the 40 to 49 year age, 21%. We had 3 people who were seen between the ages of 70 and 79. As far as employment status, the majority of our patients, the highest group, are the non-employed persons at 104, that would be 40%. There were 63 who identified as disabled, 16 people who work full-time, and another 16 part-time. 4.7% of our 261 patients were self-employed. There were 46 people who did not identify an employment status, and 3 who said they were retired, and finally 1 student, 1 full-time student. The interprofessional faculty who attended average around 10, and we have usually at least 20 students as part of each program's core educational curriculum who provide the critical clinical care to an average of 30 or 35 uninsured patients each week free of charge. 300 pairs of shoes and socks have been distributed since the inception of the mobility clinic at Grace, which was created and run and continues to be overseen by physical therapy students and faculty. Our clinic is an interprofessional practice experience that provides longitudinal chronic and acute disease management for the most marginalized members of the community, while students establish relationships with faculty role models from multiple disciplines. These interactions between students and faculty of diverse healthcare professions and the people from the community provides an opportunity to cultivate collaborative practices for providing patient-centered care for underserved populations. Thank you.